As part of Yahoo Finance's week-long special healthcare industry checkup, we're taking a look inside the world of medical misinformation. Yahoo Finance's Anjali Kamlani had the chance to dig into how YouTube is elevating its reach of quality health information with Google Chief Clinical Officer Michael Howell, along with Dr. Garth Graham, Global Head of Healthcare and Public Health at YouTube and Google Health. Take a listen.
Yeah, as a doctor, you know in your heart that the right information at the right time can help someone's life be unbelievably better. And so we have teams working to lift up the best quality information all across the company. One of the shining examples of this is YouTube, that's been working on it for a number of years. And we work to lift up high quality content, even as we work to lower and make less prominent content that isn't accurate or helpful to users.
And what is the way that you're doing that? What metrics are you using, and how are you going about doing that? Garth, if I could get you in for that.
Sure. Yeah, Andrew, we think of it like a garden. How do you weed out the information that's bad and dangerous for users in the community? And how do you lift up and plant the seeds of good information for people so that people are able to make the right decisions at the right time? So, we're an open platform, but the real goal is how do you balance getting good information to people at the right time, as Michael said, while making sure that we remove delicate or dangerous information.
And I know one of the ways that that's being done is to kind of emphasize verified, credible sources. We're talking about universities, governments, hospitals, even especially when it comes to the science and health information. Michael, can you explain to me how that was really envisioned and how you're maintaining that? What went into ensuring that this is how we now see information?
Yeah, I'll start and then Garth can lean in. So we don't want to be the people deciding. So we worked with groups like the National Academy of Medicine to define the key aspects of what makes something a credible source. And then Garth and teams that Garth worked with began to operationalize those inside of YouTube. So things like if a person is credentialed to treat you as a physician, they're probably likely to have better quality information. And so being able to operationalize that and lift those up is one of the things that's been the work of years. And Garth, you may want to add things.
Yeah, and Angela, the only thing I'll add is, we're really the first to really start labeling health information as coming from licensed doctors, licensed nurses, licensed healthcare professionals. So really this idea of identifying that credible source based on the National Academy of Medicine, World Health Organization definitions, and then raise that up so people know who they're getting information from and that they can trust that information.
And I wonder if you could respond to, there are going to be some people who might push back and say, to your point, Michael, like, who are you to determine that? And why should we then trust that you, Google, you, YouTube, are the arbiters of the information we are then supposed to accept as trustable, verifiable? We've seen that has been sort of that underlying trust problem is the key to this.
Yeah, and to the point that Michael said earlier, that's why we rely on the National Academy of Medicine that has made the decision around very complex health policy questions for the country, bringing together the world's experts. So it wasn't us that was saying that, we were relying on them. And then we just ingested those into our system. So I think, that concept of how do you rely on the experts to help identify high quality sources is something that we relied on heavily.
And tell me, Michael, I'm sorry, go ahead.
One of the things about the way that YouTube has handled it is it's very transparent. This channel is from a hospital or from a national health authority or from a physician, and then lets people link out to find more information about the criteria. And so it centers the user in being able to control and understand what's going on.
And Angela, let me just riff off the transparency point. One other point, this whole process was transparent. It was put out for a public comment. People could see there were webinars. So we really tried to make the process very, very transparent for people to see.
I wonder on that. So the way that I understand that, these are being presented is sort of like an additional ribbon at the bottom that kind of emphasizes if someone is searching for a topic, then they're guided towards these additional resources. How did you get the buy-in from sources like the government, which traditionally wasn't really doing much video? How has that relationship been? What conversations have happened to get them in the fray?
Well, quite frankly, we've seen the whole healthcare ecosystem be energized around reaching people with health information. So not just the government, but hospitals, physicians, local health authorities around the world, really have been proactive and stepped up. The World Health Organization and others around really trying to get quality health information to communities at scale.
And does that include, Michael, maybe encouraging them to make videos or working on topics that you see, on Google search kind of trending, and then having them maybe suggest that these are videos that they should be putting up?
One of the things we've seen is this emergence of a creator community of physicians and nurses and licensed mental health professionals. If there's no good content out there that people want to watch, it's very hard to show that content to users. We've seen people really respond to that on their own and through partnerships that the YouTube Health team has led.
You make a very good point. We know that during the pandemic in particular, we saw the rise of the trending, the influencer doctors, if you will, sharing information. When it comes to those individuals, do you have, sort of influencer relationships with them in terms of being able to, recommend topics and the like?
Well, we're very supportive of the clinician community that has been present on YouTube. And, what we try to do is to make sure that, as we said before, we're able to kind of make sure that people know that they're licensed and qualified and that these are the kinds of voices that, are more likely to present evidence-based information. So, we highly value our clinician creator community across the spectrum. And really, they've stepped up to the task of getting high quality information out to the community.
And what has been the response so far? Have you seen, broader engagement, better engagement with this content that you're trying to promote?
Well, we see, Mayo Clinic the other day passed 1 million subscribers. So, you're seeing where by creating high quality content, people are engaging and people are coming to these sources. So they're a good place for them to get not just their clinical care, but good health information as well.
How did you take on the role of making this happen? I think this is a good question from Michael, knowing that you have a social platform, that there is so much misinformation out there. And we've heard from, individuals like Dr. Peter Hotez, who's called out that these are, in some cases, disinformation campaigns. I'd love to get both of your thoughts on that, starting with Michael, how you thought to get into the space and when you felt the need was there for Google to get involved.
Yeah, if you take search, Google is a place where people come and ask questions about their health. And we've seen that also very clearly on YouTube. And so it was an early priority for us, since hundreds of millions of people come and ask questions about their health every day. We need to be helpful to them in those moments that matter.
Yeah, and the only thing I'll add is, clinicians across the board in the public health community have identified, quality health information as a key component of public health going forward and how we respond to the next pandemic or the next challenge. So really, we have evolved both the partnerships, the systems, the product services across YouTube to really meet that challenge. And I think that's what you're hearing a lot in terms of what's asked and what's being delivered.
And how did you staff this? Did you need to hire more people in order to do this, or did you sort of pivot another project towards it?
Well, we have clinicians across Google, expertise, deep global expertise in a variety of different areas. I myself am a cardiologist and have been in the healthcare sector for a while. So we have a combination of clinicians, engineers, people who are working all different aspects of the team, because it really is a team sport, and it's really built up, health, not just on YouTube, but across Google as well. So we really have the full spectrum of all that's required to help deliver on this from a team effort.
And it certainly was something that we saw take place in large part because of the pandemic, and in the preceding years, we saw the buildup of misinformation and disinformation campaigns. Michael, if you could, we know that this is not just a healthcare problem. This spans, including into politics and across other sectors. What you're doing right now with the health, is that something that can be applied? Is it a strategy that can be applied across sectors?
Misinformation is a centuries old or decades old problem. And so we began this work before the pandemic, but we've really focused on it. And one of the things that's important here is one of my favorite statistics that I've learned since I came to Google. So Google gets trillions of searches a year, hundreds of millions a day related to health. 15% of what's typed into the search box every day has never been typed in before. And so it's an always evolving problem that we wake up every day thinking about.